the IWK by definition works in collaboration with community partners. And we're very fortunate to have Andy Cox, who's our community partnership liaison for the mental health and addictions program at the IWK, here today to share with us a little bit about what's happening with some of our community partners. Particularly around what's still going on, how our community partners are working, and how we can continue to work with them. I will note Andy's going to do a great job of sharing with us what he knows about what our community partners are doing. I know that work is rapidly evolving, and we're actually also working with some of our partners on co-presenting some future webinars so that they can also share a lot about their programs. I also want to do a call out. We have an additional guest on the panel today, and we thought it was especially relevant given the events of the weekend. So we're fortunate to have Matt White joining us today, who's the active program leader for crisis and acute care, NSHA Central Zone Mental Health and Addictions Program, and he's going to talk about the mobile mental health crisis teams service both during COVID and in response to the recent Port of Peak incident, and how mobile crisis is supporting that as well. Before we get started, as always, I'll remind everyone that this webinar is being recorded, so there'll be opportunities for you to view it again afterwards on Pulse, and please also know that that means that your questions will be recorded as well. I'd also ask that we do what we do in other webinars, which is if you have questions, please feel free to type them into the chat or the questions box at any point during the presentation. We will save questions until the end, so I think we'll wait and we'll have Andy present, we'll have Matt present, and then as we've done in previous, I'll moderate some of those questions and bring them forward to our presenters. So in that case, I'm going to take a moment and turn it over to Andy to start presenting, and then we'll turn it over from there. Andy.
Hi, I'm Andy Cox, and I'm community liaison with mental health and addictions. And obviously, my part of my role is relationships with community organizations. And what I've been asked to do today is to talk about what are some of the organizations doing during COVID-19. That's what I'll do. I will recognize, this week has been pretty hard for everybody. I'm sure in the audience we'll have people who were directly affected by the tragedy, and we're all indirectly affected. And we will have some families, friends, and neighbors who we will we'll see, I'm sure. Anyway, we'll get back into the and that's why I'm wearing red. Red. It's Friday, so that was asked to we use that to recognize the tragedy. But to get into my presentation, I will here. On my second go to we recorded, and it didn't go well with technology and mic issues, but we can do it now. All right. So yes, COVID in the community. I thought this was kind of a neat picture. And I also want to recognize the help that I've had from community partners, and it's been hard. We trying to keep up with what everybody's doing. Things are always changing, so we don't have a question period, of course, with this recording. But even better, if you notice any mistakes with what's going on, or with my presentation, or if you have anything to add, that would be awesome. You can just email me, andy.cox, and I would appreciate that. This is a very much changing evergreen document. And right now the document is on the H drive, but it's kind of dig a bit, and only I think it's only for community mental health right now. So it's under CMHA, and then under COVID community resources. But I've been told that very soon this will be somewhere else as well. I think they're somehow creating a place where all this material around COVID is going to go, because not everybody gets access to all the H drive. We'll see how that goes. A little lightness here, so I just I'll talk a little bit about the evolution of working at home, because a lot of us are working at home. So I saw this kind of neat little picture. I decided, oh well, why don't I make it a little more personal? So this represents my first first day or so as working at home, and I'm just joking. I would never do my work with all my kids, but it just kind of shows. I think other people can relate how different it is working at home with kids or without kids, and hopefully people are getting used to that. Yeah, so I got a little crowded there, so I decided to go outside and try that, and got a little cold, and my coworker there was chilly too, and but we had had a little bit of fun there, and then even more private, went down to the old basement. We have a really old house, so that's our ugly basement, and problem down there is no cell phone reception. Those are just little bit of humor. But no, working at home is, it's been quite an adjustment. But it sounds like our clients are not are still benefiting, and seems like a lot of our clients are appreciating doing the Zoom. So I'll start in with the helplines, and I won't go into too much detail, but I will mention them again. These are on the H drive, and again will be shifted elsewhere. One place I do know it'll be on Pulse. I just got to figure out where that is with the help of Jackie Pettick. But yeah, the helplines. So for sure, mobile crisis, which Matt White presented yesterday, and you'll see that as recording. And then they're using that just at business as usual, and I know they are quite busy, especially with this past week. Other ones, of course, the kids help phone, which is they're doing of course the number, which you'll see on the drive, but the number, the text, and they're not doing the live chat over the internet. They need to put the resources to the chat, or the text and the phone. And then just recently, with what has happened, they have. And I just got the information yesterday, so I don't have it here. But they've kind of set up um, really focused on Nova Scotia, and they have some a new text number, and they're actually now doing adult. So I should have gotten that information, but I did. I know Crystal Moore has sent it around. So yeah, they had to hire new people, and they're still looking for volunteers for the text line. I mean, trained volunteers who would go through a kind of a sped up training as well. So if anybody's interested in that. More lines, more kind of warm lines, but First Nation Inuit Hope for Wellness, that's always been around, but they're, of course, supporting a lot more right now. Another ongoing one is the YMCA Newcomers Mobile Crisis Team, and they're quite busy as well. The Association of Black Social Workers have a line now around, mostly around navigation and how to help a member of the Black community find proper resources, and just to be an ear as well. Also, Pieces of Pathways, which is national, ages 16 to 29 for LGBT community around substance abuse. And there's also some of the warm kind of local lines as well. The family resource centers who are still doing awesome work, and they're being available online to talk to people who are having some problems and maybe need some navigation, but they also can help with getting some of them can help with like grocery gift cards, delivering items, um, you know, baby and young kid issues or supplies. And even the library is acting as a warm line, just people want to touch base, and a lot of their kind of regulars are doing that. And of course, with the library, there's the Libby program, which is online, an app where you can have free audio and ebooks. Finances, you've probably heard a lot of the government finances, so both the local, the provincial, and national. So government funded ones, but also some nonprofits. There's some just private people getting money together to provide for local organizations. On the drive, also around banks and what banks are how they're helping student loans, property tax, income tax deferral, power and heating, food and shelter, of course. And I will talk about shelter a little further along. That was a good question from the original recording, and I didn't have as much information as I'd like. And actually, Kelly McNeil, Kelly McLeod actually sent me some information. No, I'm good. I got a signal that about my slides, so I think we're good. Also, Wellness Together Canada portal that's just recently announced by Trudeau, and that's national, and it's about it's a place where you can get more information, but also, and I'll just take my notes here, make sure I have it right. Also, live telephone, video, chat counseling, self-directed tools such as mindfulness, internet-based CBT, peer support, group counseling, single session, multi-session interventions, those types of things. And again, I'm not putting all the information here on a slide. There's so much information, but again, it's available on the H drive. And again, we'll be putting it, making it wider known. So one of our big partners, McPhee Center, and again, these organizations just they've been awesome. I mean, we've had to pivot, and these organizations I thought would have to shut down, but they've really pivoted themselves and have just done really good work. And these are nonprofits; they don't have a lot of resources, but they've really done well. And McPhee is a great example. They continue to offer their programs. So many different types of art, which you can see on the screen, that they're still doing virtually. So this session's on now, April 6th to May 1st, but there's a new session starting May 4th, and actually they're looking for different types of classes, and again they define art quite broadly, and so they're looking for instructors. So if you have an interest, or you're some type of artist and would like to instruct, I think it's like it'd be about 2 hours a week. They're very open to that, and feel free to give me an email. Underneath Society and Art Society, a great partner of ours as well, and actually they've been helping us out. And I'm picking up today a bunch of art kits that they've created, and more than just a kind of more than just pads and pencils. Very quite large kits with so many different types of art that youth can use. And so they're today I'm picking up 20 kits, and if you know any youth, any of your clients, let me know, and I can get them to them. And I think I'm going to see if we can get some on the Garen Center. And these kits, they design, when they design them, they did follow public health recommendations. And when I picked them up, of course, we're doing some, physical distancing. So, but they've been great, and they want to be more involved with IWK. So it's kind of neat, them helping us. My manager and I, Jennifer McCarran, we were talking about how can we help these community organizations, and around capacity. And it's interesting how they're helping us. And if people have any ideas about how to help these organizations, let me know too. So it's going to be I mean, we were good partners with organizations as it is, but I think this bit of a silver lining to COVID is that I think we're going to become even closer, and really a two-way relationship. Yeah, peer support, and this is our own peer supporters who are in the residential programs in Garin. They're not working at the hospital, but they're now out in the community, and anybody can have access to them, 15 to 25-year-olds. And these are peer supporters who, they're not just youth who have um, gone through mental illness. They very much have, but are well and in recovery, and they have been trained and certified by Peer Support Canada. So this might be something that you might want your clients to take advantage of, and I would love to see this be after COVID. This be extended into the community. Strongest Families, we're all very familiar with Strongest Families, and I mean they've always been doing things over the telephone or online, and they continue to. They are quite busy, but yeah, they've been a real great resource, and yeah, they're taking referrals right now. Langhouse, another great partner of ours. Unfortunately, they are with not just COVID, but they're also going through a transition. They brand new executive director, which is exciting as well. But they've also had to lay off some people during this time. So they are keeping up with the members. Checking in with them, doing some activities, kind of cooking over Zoom, different activities like that. But they're not able to take new referrals at this time. I am meeting with the new executive director next week, so I'll get some more information then. Yeah, so Phoenix programs. Besides the residential, the other programs that um, that they offer are mostly they're still continuing in some degree over online and telephone. But around shelters, yeah, I was asked the other day, and I didn't have a great answer. But Kelly McLeod did a lot of research around shelters, and maybe I'll talk about all of them. But with Phoenix, the shelter is still open. They're trying to have their youth support them in community as much as possible, with gift cards and phone cards and food baskets, and just trying to find a place for them, because physical distance distancing at the shelter, very hard to do. But yeah, if a youth needs, the youth can call during business hours, or we can refer, or even during evening weekends, if as long as there's an outreach worker, they can hopefully get a bed. But again, they're really trying to really get them in the community. Other shelters that are taking youth, female transgender individuals 16 and over during COVID, are Bryony House, Berry House, and Asdom House. Metro Turning Point are taking 16 years and over during COVID-19. out of the cold shelter, emergency winter shelter. They are taking male, female, transgender, 16 years and over, who've stayed there before or are connected with the Mi'kmaq Friendship Center. A lot of what they're doing is having the youth in hotels, and therefore they can't offer as much as they'd like, but they're doing what they can. And there's been some pop-up shelters, one for men, male youth, and transgender, which is at Siddle High, and other one. The other one, YMCA Godding Street, is for women, female, and transgender individuals, 16 years and over. And Asam House, Berry House, and Out of the Cold Shelter can refer to the pop-up shelter for women. But yeah, the other Phoenix programs, as I said, like the center and employment, education, it's all through online or telephone. So yeah, our Pride Health, the biggest thing the reason I'm putting there is because, again, on our H Drive, they did an awesome kind of resources booklet, quite a large resources booklet around COVID-19 and Pride. So it's a really neat document. So I encourage you to take a look at that when you do have access to it. Or maybe you can even Google Pride Health Raising the Flag, IWK and SHA. Yeah, another great partner of ours, the Youth Project, which they are continuing to do some things. They even wrote a kind of a policy, wrote policies around COVID and what they're doing for their youth, and it's pretty impressive. They're continuing to do a lot of their programs over Zoom. The programs being, please. Yeah, the programs being the Transformers program, the non-binary Hangout, Gender Creative Kids, and you can access us through their Instagram or just contacted them. And they, it's kind of neat, part of their policy is during their facilitating their online programs, they're having two staff. I mentioned the Mi'kmaq Native Friendship Center, and then the Medicine Wheel. I thought this was really cool during COVID. Stephanie Jollymore actually sent this to me, and I just think it's really neat to bridge the two things and be quite positive, actually. But the actual center, they are mostly doing things like online smudges or online drumming or lessons around drumming. Unfortunately, the powwow will be canceled this year, and also the games as well. So it's kind of sad, but hopefully we can help out more there as well, because even before COVID, the center hasn't had a lot of resources. They have tried to get resources, but haven't had a lot of resources around youth. So hopefully we can help push that. Autism Nova Scotia, very strong partners of ours, and they have so many programs. So I won't go through them all, but a lot of them they are still doing online. Yeah, where would I start? A few of their pre-employment programs still being coached over online. I think about Launchpad, one of them. Virtually will be there. Well, of course, their summer camps are canceled, but they're trying to get their Dungeons and Dragons Club online. They're doing their Bridges to Success online. Supportive social groups, not right now, but they hope to do that. And please let me know if you know more. This is a bit of an old document I have for them. Chat and Chill will be virtually. Autism Arts postponed to the fall. Their Healthy Relationship, Sexuality, and Autism (HRSA) is virtually online. Again, all that is on the H drive or where we put that information that everyone will have access to. VTELS, they continue, well, they do so many things, but I think of mental health, they're continuing to do their counseling and advocacy. Their counseling being what I would say tier 2 strengths-based, and doing a lot of advocacy and navigation. Eating Disorders Nova Scotia, they are doing still doing quite a few things as well. On the website, excuse me, and on the H Drive, there's almost like a newsletter that talks about the things that they're doing as far as webinars, but they're doing some educational webinars, including some for youth. Their main function, the online peer support, that's mostly it is mainly for adults, and they would love to partner with us and create something for youth as well in the future, of course. I thought I'd throw this in because I'm sure our youth are getting being on screens. I'm sure getting more cyberbullying. So CyberScan is there. And of course also domestic violence, which I've read that domestic violence, of course, has gone up for sure, but reporting has gone down because the attackers usually at home all the time with the family, and also as far with the children, they're not getting the reports aren't being children aren't being seen by their teachers live, and so they're not getting reported, and of course, again, the attackers probably aren't allowing too many phone calls against them. But yeah, they have some websites and some emergency exit buttons to get out of the attackers around. So back to the Kids Help Phone, and again, I urge you to. It just came out yesterday. I read it, but I urge you just kind of what they've done for Atlantic Canada, Nova Scotia. They've added some numbers, and they've also gone to included adults. So Kids Help Phone is such a great resource, and we are officially a partner with them now. So. This again is the portal I talked about, and I just checked it out a bit. You have to go through kind of they do ask how your mood and all the kind of those types of situations, and then you get through, and then there's a lot of material there, including online type of counseling. I kind of said the other day, this is great, and Trudeau and the government's doing this, but too bad it took a physical pandemic for the government to put so much money into this, whereas we've been in a mental health crisis for years, and we haven't got this support. And yes, the Halifax libraries, which I mentioned, are being very much a warm line and very open to anybody calling, but a lot of regulars do call in, and of course they also continue to do some research or all the research. Again, the Libby app is kind of neat. So that wraps up my presentation.
Thank you for that a lot, Andy, and I appreciate it. It's a challenge for all of us, I think, as we start to adjust to how to get sound working well, and you did a great job. I know it's a bit of a challenge. Great. And for me, it's heartening again to think about how our community partners are in this adaptation phase, just like we are, thinking about what they can be offering and what they can continue to do to support our communities. So at this point, I'm going to turn it over to Matt. And Matt, I think I see your screen right now, which is great. And you'll probably just have to unmute yourself when things, when you're about to go, and I'll turn it over to you.
All right, perfect. Thanks so much. Can you hear me now?
Sure can.
Okay, perfect. There's I think it might be a little lag or delay, so I'll try not to jump too quickly into talking to the next thing and make a mistake. So quickly, thanks for having me. I'm just going to give a really brief overview of the crisis team. I think most folks on the call are familiar with the crisis team, so I won't dwell on it for too much, rather than to focus more of our time together on some changes that have happened since COVID, as well as what's been happening with the provincial crisis line as it relates to supporting folks after the tragedy in Portapique. So for those that are unfamiliar, quickly, the crisis team is a partnership between the Health Authority, the IWK, and the Halifax Regional Police, as well as their service agreements with EHS and 811. So the crisis team provides the provincial crisis line support across the province, and is tied in with well, pretty much all of the health services across the province. So what we do have is a long tentacles that can support people in a variety of ways. From the what is the purpose, why are they there? I said their goals are obviously to be the right service at the right time, and right now, considering all that's going on in the community, I think that's more pertinent than ever. So when we're talking about what the crisis team is doing, it's really, folks are reaching out for a variety of reasons, whether that be related to social isolation due to COVID, or right now presently struggling with what's happened in our province over, on Sunday and the fallout from that. So really, it's not about defining what crisis is for people. As people, if it's a crisis to them, it's a crisis to us. So really, it's about supporting somebody where they're at and helping connect them with the most appropriate follow-up go forward. So right now, and I'll talk about that a little bit later, about some of the things that have kind of been put in place that we are directing folks to right now. From a crisis perspective, those that are familiar with it, really we do try to start from a place of being least intrusive first. So like all health services, best when someone wants the service, reaches out for it and receives it in a timely, supportive manner. And utilizing someone's natural support networks, and looking at what might be what might be supplemented as far as people's coping skills and things like that. For those that have worked certainly with the mobile component of the service, we also work under the parameters of the Involuntary Psychiatric Treatment Act. So the team is out in the community. It remains out in the community during this time. They haven't. There's been no restrictions put on who the crisis team goes to see during COVID. So where the service area where they go and who they serve remain the same, which is everybody from children to adults. And they've continued to be out supporting people in their homes. For those that are wondering, they do ask the screening questions before they come out to see everybody as it relates to COVID, and staff are wearing PPE as appropriate. And we have had several occasions, because I know it is front of mind related to PPE and things like that. We have had several occasions where staff have had to wear don full gear as it relates to PPE and gowning and things like that, because of somebody's screening questionnaire, as well as the fact that they absolutely had to be seen today and come into hospital for a variety of reasons. So from a crisis team perspective, they want to, obviously start the least intrusive and move their way up. But for those who have heard me speak before, and I've probably overused the term, but I always describe us as we're the least intrusive people you've met until we're the most intrusive people you've ever met. Because of our partnership with the police, we can escalate in terms of our support. So, oftentimes we're a first toe in the water for someone who's accessing mental health services, and now more than ever, people are reaching out. People, may want to be anonymous, and that's okay. We don't require registration to access the service. And as far as youth contacts go, we do forward every youth contact we have to the IWK and to central referral to be distributed as appropriate. And for those that we do know, obviously we look to connect them with services as appropriate and as required. And as risk goes up, as does our escalation of services. So because of our police presence, we do have the ability to do kind of cold door knocks for folks if they're worried about somebody and no one's been able to reach them and things like that, or we believe they're decompensating their mental status, as well as um, going and doing sort of more assertive community outreach for those clients that maybe lost a service for some reason or another. And we do work closely with psychiatry, both at NSHA and IWK for those that might require direct admissions and things like that. And I'll talk about how we've been kind of working on that process to facilitate that during COVID. I'm not going to dwell on what crisis versus psychiatric emergency, but probably I'm going to jump ahead directly to what's been happening since the pandemic. So,
The
yeah.
slides aren't moving. I don't know if you're sticking on the same slide or if you were moving them, but the slides are.
Oh, perfect. There we go. Can you see it differently now?
Yes, I can.
Yeah. Okay, perfect. Sorry about that, folks. I said that this is a new system to me too. I said, Andy, we're in this together, buddy. That we're working on it. If folks are wondering what's been going on sort of on a week-to-week basis, so if you think about when the state of emergency was called in March and sort of what's been happening, you can see kind of a steady increase. So for week ending April 18th, they're up almost 100 calls over the previous week. And that's kind of what we're seeing nationally as well as it relates to crisis lines. That's to be expected, and so more people reaching out as some social supports are not available, as well as other community-based resources that might have stood previously are not as available. So that's kind of a snapshot about of what's been happening as it relates to call volume. And what are we doing to match the need as it relates to that increase in volume? So because of the fact that people are working differently in our mental health and addictions program, there has been some availability of additional clinicians, so additional clinical support. So we've had already 2 clinicians redeployed to the crisis team to provide additional capacity to manage that need. And we're in the process of training some additional clinicians across the province who already work on the crisis teams across the province to provide additional capacity to answer these calls and direct people most appropriately. On top of that, we have been working on some pathways with psychiatry as it relates to direct admission process. So, as you folks are well aware, coming through the emergency department right now is not ideal unless absolutely required. So, looking at what we can do to help support people accessing inpatient admission as required. And I know some psychiatry is doing virtual care, so we're working on a process for that. The forms can get to where they need to go. However, we can still locate that individual and bring them into hospital as needed. The other big thing, of course, since Porta-Pick on Sunday, there's been a lot of work done provincially, and so how do we support people? So thinking about RCMP and their families, that need to have those folks connected with follow-up mental health support. So our occupational stress injury clinic is providing short-term crisis counseling or short-term supportive therapy. I apologize, not crisis counseling, supportive therapy to those members and their families, as well as ongoing care should an OSI have occurred. So the pathway to that care is through the provincial crisis line, who will be helping support that person in the moment and then connecting them with OSI for follow-up and within 24 business hours so that we're able to get that support connected. And as of this morning, there's been a launch of support for first responders and their families. So not just RCMP, but any of the first responders, whether it be municipal police forces, fire, or EHS and their families. And that support is going to be provided by our Center for Emotional Health, Dr. Abbas and his group. And again, that's going to be routed through the provincial crisis line as a pathway for support. And so the crisis line will be providing gathering some information, providing some interim support, and again, arranging follow-up within 24 business hours for somebody, any of those first responders who are struggling. as it relates to the general public, anyone who is struggling post Portapic. And the crisis line, I will tell you, has been heavily utilized by folks who have lost a family member or had a family member involved in that incident in some way. The crisis line has seen multiple family members already, people who are struggling as it relates to this and the impacts and followed from it. We do have a pathway set up through Northern Zone, who is kind of coordinating or quarterbacking support across the province for connection with you folks as well, for connection and support for those that are struggling. So those are kind of the resources that have been put in place now for those that need that support. I think probably that would be sufficient for now. I said I've got close to my time, if not over. So at this point, I would probably, to make sure there was time for questions, I'll turn it back over and stop sharing my screen if I can figure out how to do that.
Thanks, Matt. And Matt, thank you so much. I think it was really timely that you were able to join us. I know that we had thought about this even before the most recent events, and it's been really, I think, reassuring and helpful to hear just how much the province is coming together and crisis supports are coming together to support our community at this time. So thank you for that. I might ask, as we're moving into questions, Andy and Matt, I'm wondering if you can turn back on your video, if that's possible to do. Andy, I know you had yours turned on previously. And Jen, I might need you to come on to help us know how to get Matt out of screen sharing and back into sound.
I think, did I do it?
You did it.
Hooray.
Awesome. See, lessons learned as we go along.
Good.
Beautiful. So there's a couple of questions coming through. So I'm going to start by asking those and we'll kind of go through as we go forward. Hi, Matt. Nice to see your face there too. So we have one question coming in from Lindsay. So I've always been curious about this. If all of the mental health mobile crisis team clinicians were on calls and a person calls the line, does it go to an answering machine and how long would it take to get back to them? Are people asked to call back or would someone from the team contact them?
Sure. So historically, that was an issue that we ran into, that you only had one option. It was either if you didn't get somebody live, then you had to leave a voicemail, and that was heard loud and clear that that wasn't sufficient. So what we ended up, we had an upgrade there. I'm going to say about a year and a half ago, almost 2 years now, where we did have an upgrade to our phone system. So now hopefully you still get a live body, because with that upgrade came 2 additional clinicians, but to help support that service. But what we are able to do now is there is a mode that you can actually wait in queue if you want to, in order to make sure that you do speak with somebody. You can still leave a voicemail if you want to, but you absolutely can leave a voice, or you can wait in queue, and we are able to measure that from a quality perspective. So it's, kind of consistently, since we started measuring that, wait times have been about 0.7 to 1.3, 1.5 minutes. But where there are outliers where folks have had to wait longer, and again, we actually have some ability to quality control that now. So historically, what would have occurred is, again, if you would have said, "Geesh, I called on Thursday and there was nobody who, nobody answered my call or returned my call," all I could do is go to the people who were working on Thursday and say, "Hey, was it busy Thursday? What was going on?" Which is not quantitative and not acceptable in sort of a data-driven healthcare environment. So what we can actually do is log into the live environment now, look at it, see what was happening, and if there was a quality control issue, address that.
Incredibly helpful. Thanks for that. Andy, I know one of the questions that has come up, I'm getting some texts, but also in team conversations, and you hinted at this a little bit, but I wonder if you can talk a little bit about what's happening with shelters in the community. You touched on Phoenix a little bit. What supports are currently being offered and how we're supporting sort of our particularly at-risk youth. And I'll ask you to hold your mic super, super close.
So I do have a listing on the H drive of youth and adult, and then some of these the pop-up shelters. But yeah, with the Phoenix shelter, what I'm hearing, and again, Kevin may be able to help with this, but I assume or what I'm hearing is that it's working the same. Of course, them trying to do the whole physical distancing, which is hard for youth who have barriers and are trying to, they don't want to be there all day, and but the other, I'm just trying to think, the other shelters, which I do have a list of them, but they are, I guess, bottom line is they are taking people, and just, but I, it's a hard time doing the whole isolation and the whole, I don't know if I answered that question, but the biggest thing is that the information is on the H drive.
Great. That's fair. And I want to let everyone know. So when Andy's referring to information being on the H drive, I know right now that information is on a community H drive. We are actively working, and hopefully in the next day or so, going to have all of this information available program wide. And we'll actually be sending out some of these resources after the webinar as well. So we'll make sure that everyone gets that. Another question for Matt from Jay. Can you speak a little bit more about what is the Center for Emotional Health, and can you talk more about that?
Sure. So, and again, I'll say that with the caveat that that's not my area of expertise. So I said, if you may at some point want to reach out to Dr. Abbas and his group, as they would be the ones best situated. But they specialize in providing support and supportive therapy to individuals whose emotional distress doesn't fit is easily categorized in something like a major mood disorder or something of that variety. So they require something different in support. And his group always gets, he gets very creative in how he provides that. But he has done a lot of work in talk therapy, and was well situated to provide this supportive care for individuals who are obviously going through a very significant stress or a life event and trauma that's occurred.
Thanks. And are they providing those services virtually right now, or are they doing that face to face?
It's going to be virtually, so it'll depend. Virtual care will be available. Telehealth, telephone will be available, and for those that wish it or require it, in person will also be available. So no options are off the table right now.
Beautiful. A question from Sabina. So first off, thank you, Matt. And wondered if you can speak a little bit to the process for when an IPTA needs to be invoked from a virtual visit, specifically the paperwork side of things.
Sure. So Dr. Josh Green and I know Dr. Chahil have been pretty involved in the process. So my understanding is going to be that the physician, if they've had a virtual visit with somebody and believe they need to come in under the Act, there'll be some blue bags available, and I said you folks know those. The forms can be completed virtually and couriered in, and the crisis team will be notified to arrange to locate that individual and bring them into hospital as required.
Right. Sorry, I'm just keeping up with questions here. So one from Michaela, which I appreciate, and Matt, you hinted at this a little bit, but are we noticing an increase in calls for youth? And do you know anything different about sort of differences between adults and youth regarding the number of calls compared to before COVID?
So consistently for the crisis, it's funny, even in times of crisis, the calls increase, but the split doesn't. And which is kind of one of those interesting phenomena that I really have no answers or speculation. So we've always kind of had about 20% of our calls have been youth or youth related, and that stayed consistent even as call volumes has increased. The other is adult based. So the call volume has been up as it relates to youth calls. I suspect some of that also is they have the youth help phone and other options available to them. But that's always been a kind of a steady split for our crisis line.
And still seeing that sort of split staying the
Absolutely.
same.
Yeah.
Interesting.
Yeah.
And Matt, can you talk a little bit about the themes that you all are hearing for people reaching out for support right now? What are some of the common things that people are conveying and looking for when it comes to support?
I think again we're living in very abnormal times, and so folks are struggling a bit to make sense of that. So we are seeing folks feeling quite anxious, with feeling isolated as it relates to COVID. At the same time, many of the crises that existed pre-COVID still exist now. So there hasn't necessarily been a huge change in the crises that people are experiencing. Certainly in the last 4 days, we're seeing an increase in people struggling specifically with trying to make sense of what happened in Portapique, trying to feel safe and struggling with the fallout as it relates to their own lives, as it relates to loss of a loved one or someone they knew or a family member. So that's been very real, and I know the team is very immersed in that work right now.
Um, Andy, question for you related a little bit to how we continue to engage with our community partners as we go forward. Any advice for folks working within the IWK and how we stay connected to the community groups that we were traditionally connected to?
Actually, that's pretty interesting because my manager, Jennifer McCarran, she brought that up at one of our shared care meetings, saying, how can we reach out and do some capacity building with these organizations. I mean, I already mentioned the Wonder Meat. They're coming and helping us with the art. But yeah, Jennifer was asking, how can we do that? So yeah, I haven't thought a lot of it. I did connect with Langhouse, especially since they're kind of in that transition. But I'm open for ideas. It's the right time because we are, as a program, and have been wanting to partner more. But I'm up for any discussions. I do know that I've been in contact with them all, and they're very open to. Most of them are open to referrals.
Great. It's good to know. I think similarly that even one of the themes that we've heard in a lot of these webinars is that working virtually changes the method of how we work sometimes, but some of the things that were behind there, how we communicate, how we collaborate with our communities are still really important, and they're still there. Our community partners are still there, and we're still there doing this work. And how do we continue to share this work together, I think, is an important thing.
And this is maybe one kind of silver lining, is that I think this is forcing us to partner and to not just us refer clients there, but us help them.
Yeah, I think we're recognizing just how much expertise there. We always knew, but especially always just how much expertise there is in the community. I think about Strongest Families and how some of their programs we've been offering for a long time and have been important partners, and now to recognize their expertise in providing some of the distance treatments, I think is really, really key. I have a question coming in from Christy. So I met with a youth for a priority choice this morning. He and his mom are looking for some resources for grief and loss of a friend, and triggered anxiety. He's been managing his OCD and it's really spiraled. Are there some links that I can and research that I can send along? So I think this is a common question we're getting from a lot of people right now, or what can we do to help support families who are dealing with grief right now or dealing with loss? I turned over to either Matt or Andy to talk a little bit about that.
Just mention quickly about community resources, and this is before Sunday. I've always found it hard to find groups for youth grief. There's a lot of adult ones, but I have made a connection with what I'm known as a health authority with. They do a little bit, and they'd like to do more. It's interesting. The IWK are kind of do grief around for parents who have lost children, but as far as the youth, yeah, we do need to more of that, and hopefully after this week, more of that. I think it was a really good. I didn't get to see it, but a great webinar this morning that MHA.
Matt, any comments from you? I know that you guys are probably getting some of these calls right now, and I know you've talked about being a resource and rooting people through. Anything that you think is important to share there?
From our perspective, what we've been doing is really, if somebody requires more than what we're able to provide, so it's beyond, as you described, the sort of that normal response that we would be expecting for someone in this situation. That's when we are connecting with that resource through Northern Zone and having them kind of triage what might be most appropriate from there. Because otherwise, my community-based resources, as Andy said, are through spiritual care and things like that would be really where we would probably try to direct somebody to.
I think that's really important, and I appreciate again hearing how much the local community is supporting, and that I know everyone's sort of jumping in and really wanting to find some way to support, and I think knowing how that community is mobilizing and how potentially our role is to help support the community in mobilizing versus directing everyone to a particular place is really important. So I have one coming through right now. Another one from Lindsay. So I have one more question. If you get a call from someone who's actively suicidal, but they do not provide any of their information, is there a way for the calls to be traced to identify their location? And if so, would that happen? Wondering what would happen in this case.
Yeah, we do have some abilities to do that. So if there is some imminent safety concern and someone's not willing to disclose their location, for the most part, we are able to do that. I will be honest, there are some very sophisticated computer programs that people are using to call from now that are confounding at times, although generally those people who are using those programs aren't using it for that purpose. The swatting and that kind of stuff. We've had a couple of weird things that kind of have come up as it relates to that stuff. But so anytime we've been able to identify where someone's calling from.
And I guess kind of on that note, as I know we've heard from many of our staff, as we're transitioning more to virtual care, I think a lot of our staff are thinking even more actively about risk of our clients. And I know one of the things that often gets brought up is what if they just hang up? And I'm concerned about their safety at that point. I wonder if you could talk a little bit about that and talk about how sort of your team works in collaboration or in partnership with some of the treating clinicians as well.
Sure. So I think, it's we're doing work in a different way, but we're not doing different work. And so when we think about, if somebody made a statement that made us feel that they weren't safe or was unwilling and they kind of stormed out of our office, what will we do? And if, I think it's very much the same when we're providing virtual care. They may not be physically in front of us where we can kind of reach out and, not that we're going to grab anybody. I said, but if not that we reach out and stop somebody and have that conversation, I think we're going to try to re-engage that person because that's what we do. And if we can't, then again, we look at, is this a call for the crisis line? Is this something so emergent that, someone's reported they've ingested something and we need 911 now involved or something like that. So, but, we continue to do the same thing we've always done.
That's helpful. And do you notice any differences? I'm also getting a bit of a conversation right now about whether or not the public has any perceptions about mental health being closed or maybe not being as accessible as it was before, whether or not you're seeing any different themes that are coming up in some of the calls now versus what might have been coming up pre-COVID?
As the messaging kind of came out around how we were all starting to work differently, there was, I think, some communications from some areas, not from our systems, but from outside community providers that may have been just a miscommunication or something like that. So we've worked very hard, I know, from the line to continue to reinforce that these services are still available, they are still open. And helping people connect with them as required. And when necessary, sending out contact forms to the clinicians, say, hey, we've heard from Matt, and Matt thinks that maybe you guys are closed. Can you reach out to him? We continue to do that liaise work. Yeah.
I think that's great, really how we're coming together to support communities and help getting people to the right places for the right things. So getting people to crisis when they need crisis and getting people to care when they need care and getting people to community supports when they need community supports, which I think is a really nice theme of today. Just in the last minute or so, I wonder, we've sort of been ending each of these webinars with a bit of a closing thoughts from our speakers and any kind of advice for people as they're going forward from this. Andy, I wonder if I could start with you. Anything as a program that we should be thinking about as we're embarking on virtual care and supporting communities as we're going through some pretty challenging times?
Well, I'm very happy to hear, and I've heard a lot about people wanting to utilize community. So that just shows our trust in the community and our need for the community. So I would continue to even though they're doing things differently, let's keep doing that, and let's show that how much we do need them, and that'll benefit them in the future as well, right? So, that need.
I love that. I think, again, it's one of the themes that we hear coming out of a lot of these is that it's making us even, I think, more appreciative in just how obvious it is how connected we are, even if we're physically apart, that how we connect with community is still just as important as it was before, and really, really valuing that, I think, is is a flip side of some of the challenges that we've had. Matt, any closing comments from you?
I think just as I kind of said earlier that, you know, we're working differently, but we're not doing different work. And that it's so important, as you've highlighted, Jill, that, you know, there are different areas that are doing, you know, the different pieces of the pie so that nobody has to feel like they have to do it all themselves. And that, you know, each place is their own, you know, has their own piece of the pie, as you said, to do. And from our perspective, you know, we look to you folks at the IWK, you folks, the work you do are just unbelievable. The care you provide to your clients is unreal. And so, you know, I know in this trying time where work is stressful at times, as well as, you know, trying to manage family and life, everything going on, you know, just to if you guys can just take a moment and that if you can see how us as the other providers see you folks, you guys are just unbelievable, and give yourself the credit you deserve. So thank you so much.
Thanks for sharing that, Matt. I think it's an important message for our organization to hear as well, and for all of our team to know that it really is that the work that's happening really is appreciated and recognized outside of here. And I'm going to steal your tagline of "we're working differently but not doing different work," because I think it's such a beautiful way of summarizing what's happening now. So I just want to close by thanking both of our panelists again. I mean, the opportunity to share this information with the broader program is hugely valuable. And I will say that we continue to get asks for people to watch the webinars who weren't able to attend. So know that your impact will go beyond even the 50 or so people that we have on today, which you've already reached. So thank you for that. I'll remind everyone that these webinar series are on Pulse, so you have an opportunity to access them later. We are actively planning for our future webinars coming up. So if you have any ideas or thoughts or things that you would like to see, please send an email to our team. Just as a reminder, it's MHA virtual practice at iwk.nshealth.ca. So please let us know any additional questions you have. And otherwise, have a great day.